Screen time is expected to increase as more people work and study from home and seek entertainment during the circuit breaker. Experts are highlighting the importance of ensuring eye health as we spend more time in front of screens.
And for more, we're joined by eye epidemiologist, Associate Professor Mohammad Durrani. Thank you so much, Professor, for joining us. How can we ensure our eyes remain healthy during the shutdown, especially for children?
Well, it's incredibly strange time, so I think it's got to be a family effort. Particularly parents have an important role to play with setting the etiquette, particularly as kids are sort of sponges and follow behaviours of their seniors. But it's important that children are spending appropriate times on devices. So truly, those that are aged 2 years or less shouldn't have any screen time whatsoever. Those 2 to 5 should be spending about 1 hour, broken up into 2 or 3 segments. And then those aged 5 or 6 or older shouldn't be spending more than 2 hours a day, broken up into 4 quadrants. And really, so it's efforts from the parents, as well as Singapore has a wealth of information that they can also access through the Ministry of Health and Education. And this is the reason Plano has provided the premium subscription, the annual one, absolutely free for all Singaporean parents to help during these trying times.
And what would you consider a reasonable amount of screen time for adults then? And also, would changing the brightness or settings perhaps on your screen help in any way?
So whether it's children or adults, we have to take into consideration time on devices, frequent breaks and walking away, whether it's your tablet or your phone, walking away every 30 minutes or 45 minutes, particularly during these times because we're sitting for a lot longer. Avoiding the blue light, avoiding using your phone, particularly later at night, which sort of mimics that it's daylight and sort of interferes with your sleep as well. Posture as well, we're talking when we're seeing evidence for text neck, also smartphone thumb, also digital eye strain. So if you sort of think back 15 to 20 years ago, we would spend that 6 to 8 hours with lunch and a late sort of morning tea break. But now we're moving from computer screens off to our phones and tablets and so forth. So even for adults, it's important that they sort of manage their time, manage their posture, manage their distance away from the screens and their lighting conditions before they sort of get the symptoms of digital eye strain, which sort of can mimic migraines and give you blurred vision, redness, photosensitivity, which is sort of being a bit sensitive to the lights and so forth. So it's not just sort of restricted to children. It is affecting adults, but in a different way. The concern with children is, of course, the myopia and the risk factor of excessive device use sort of leading to the development as well as perhaps speeding up the progression of myopia. And we want to try and avoid the incidence of high myopia, which we all know is associated with sight-threatening conditions. So this is of particular concern. It's not just a Singapore problem, it's a global problem. And by the year 2050, half of the world, 5 billion people will have myopia, of which 1 in 5 will have high myopia, putting them at risk of vision impairment or blindness in some cases.
So are there any specific exercises we can do to help our eyes? Previously they said that if you're reading a book, look out a far distance, look at something green. Does that actually apply for, screen time as well?
Yeah, absolutely. So the new sort of substitute or the new sort of risk factor that's playing or mimicking that of near work, which was books read per week, or the amount of time you're reading, is screen time. This is a phenomenon now. We know that our 2-year-olds are almost spending up to 2 hours on devices. Our 6 to 9-year-olds are spending up to an equivalent of a working week on screens itself. And in these particular sort of trying times in COVID-19 pandemic, we've got to make sure, because there's schooling at home, there's also the entertainment purposes of using devices. And so really those frequent breaks, looking out to the distance, following the regulations set by the government, but trying to get some of that outdoor exposure as well is important. And then, of course, providing it through an efficient and effective platform for online booking to optometrists through the Plano Eye Check is also important. So timely and regular comprehensive eye examinations that you would get at an optometrist is also very important. Exercises are not ruled out for the eyes and are particularly important for those children that may have a lazy eye or a turned eye, if you like.
Cool. Thanks very much for your insight today, Associate Professor Mohammad Durrani.